mean, I define it as being sort of coercive paternalism, really. So it's not just regulation to require, for example, restaurants not to have rats running around in it, or signposts saying, don't get too close to the edge of this cliff. It's when the government is deliberately trying to deter adults from doing things that it doesn't think adults should be doing, even though the adults themselves obviously disagree. And so we're not talking here about correcting genuine market failures. We are just talking about paternalistic actions.
Welcome back to the IEA podcast. I'm Matthew Lesh, the Director of Public Policy and Communications here at the IEA. This podcast asks a tantalizing policy question each week. Today's question is Britain a nanny state? Imagine a world where the government tells you what you can eat, drink, smoke, or even how much sugar you can have in your drink. That's not some dystopian fantasy. It's the lives of billions of people across the planet. And from extended sugar taxes to junk-free ad bans, state interference in lifestyle choices really only seems to grow. So in this episode, I'm going to be discussing the latest edition of the Nanny State Index, released this week by the IEA in conjunction with EPiCENTER partners. The Nanny State Index is authored by our own Chris Snowdon, who's the head of lifestyle economics here at the IEA, as well as the author of numerous publications on issues ranging from gambling to public health. Welcome, Chris, to the podcast.
Hi, Matt. Thanks for having me on.
Before we get into the index, I'm kind of interested, what is the nanny state? I think it's a phrase that's now become kind of amorphous when we talk about these issues, but I'm intrigued in what counts as something kind of nanny stating and what is just, I suppose, general government interference in our lives or policy or economics.
Yeah, I mean, I define it as being sort of coercive paternalism, really. So it's not just regulation to require, for example, restaurants not to have rats running around in it, or signposts saying, don't get too close to the edge of this cliff. It's when the government is deliberately trying to deter adults from doing things that it doesn't think adults should be doing, even though the adults themselves obviously disagree. And so we're not talking here about correcting genuine market failures. We are just talking about paternalistic action. So the Nanny State Index basically has four components. It's e-cigarettes, tobacco, alcohol, and food/soft drinks. And these are all the areas that public health paternalists have been focusing on for years and years now.
So yeah, as you've said, it's distinguished from kind of, I suppose, normal kind of justifications of state interference. It's also probably a little bit different from public information campaigns. So you're not necessarily focused on when the government says, cigarettes are bad for you. That's not necessarily paternalistic per se. I suppose it's all different, also slightly different from nudging, which is to say, I suppose nudging can be paternalistic, but in its purest form, it should be, encouraging people to make a better decision, rather than what you're talking about is forcing people into making a different decision to what they otherwise would have made.
Yeah, and there's always going to be kind of a little bit of grey area around some of these things. So, for example, this week, Canada has introduced, or said it's going to start introducing, individual health warnings on cigarettes, right? Really kind of far out idea. It's been knocking around for decades, actually, on the fringes of the anti-smoking movement, but Canada has adopted it. Now, some people could say that that's just giving information to people. But given, if you've seen what a Canadian cigarette pack looks like, let alone all the anti-smoking advertising that's been going on for decades, nobody is in any doubt about the health effects of smoking. So the idea that there is a genuine information failure here and that consumers are only smoking because they think that cigarettes are good for them is clearly absurd. So I would say something like that is a nanny state measure. It's just designed, rather like the graphic warnings are designed, to deter people from doing it, not by giving them new information or information that they're not aware of or need, but just by making cigarettes look stupid, and making the packs look revolting. So I think that's where it crosses the line from genuine education, which can be justified on kind of liberal grounds, to being nanny state. So that's one example of it. And you do get other areas which are a bit more contentious, like the calorie labeling on menus. People have different views about that. Personally, I think that probably still just about counts as legitimate information. It's not really wagging a finger as such. But most of the stuff in the Nanny State Index is pretty obviously paternalistic, syntaxes, for example, which go far beyond what you would need for them to be defined as Bergovian taxes.
Let's get into that then. What is the Nanny State Index? What have you found?
Okay, so the Nanny State Index we've been doing since 2016. We do it every 2 years. It's got 30 countries in it, all the EU countries plus the UK plus a couple of others. We've got Turkey in for the first time this year, and Turkey immediately took the top spot. It has a complete ban on the sale of e-cigarettes. It's pretty draconian when it comes to both alcohol and tobacco. And so it has pushed Norway off the top spot. Norway now I think is second. Then you've got countries like Lithuania, Finland, Hungary, Ireland, a bit of a mixed bag really. It's fairly predictable that you'd see at least a couple of Scandinavian kind of nanny states, as it were, social democracies up there. Maybe fairly predictable you might see a couple of fairly autocratic countries, authoritarian countries like Hungary and Turkey. And then you got Ireland, which has been very keen on nanny state measures for about 20 years or more. And then Lithuania is one of a number of Eastern European countries that in recent years has really been clamping down, not just on alcohol, but also on energy drinks for some reason, and on vaping. And the bigger picture across Europe is that there's very, very little liberalization. Norway repealed its sugar tax a couple of years ago. That's about the start and end of liberalization. It's just gradual and sometimes quite rapid increase in nanny state activity across the board, not generally driven by the EU itself, usually driven by domestic governments copying one another. And the UK it's only 11th. Some people in Britain might be surprised it's only 11th. It's not because it's been liberalizing anything, quite the reverse. It's now the second worst country for food and drink regulation. It's still number one for draconian anti-smoking regulation. It just happens to have a fairly laissez-faire, relatively laissez-faire attitude towards e-cigarettes, as does Ireland, interestingly. So both those countries would be way higher up if it wasn't for that. And at the bottom of the table, you've got places like Germany. Germany, ever since we started doing this, has been the best country. The freest country, quite low sin taxes, relatively relaxed attitude towards smoking and vaping and so on. No like excessive food and drink regulation. Then you've got places like Czech Republic, Luxembourg, Spain, Italy. The Mediterranean countries tend to do a little bit better than the kind of Northern Europe, Scandinavia, and Eastern Europe. And the point I would make, amongst many really, is that if you look at the countries that have got less regulation, and there's a massive difference between places like Germany and places like Turkey. I mean, it really is a huge divergence that some countries have been on. What's wrong with living in Germany? What's wrong with Luxembourg and Italy and Czech Republic? These are all perfectly nice, successful, reasonably prosperous countries, and there's no difference in life expectancy or health outcomes. So the primary aim of these policies doesn't obviously seem to be working. It's not as if the countries that don't have nanny state policies are all falling apart. They're failed states and people are dying in the streets, whereas the ones at the top, like Turkey, are tremendously healthy, happy, and prosperous. There just isn't any correlation. And I think people in different countries get used to certain policies, and maybe are so parochial they don't really think about what it's like in other places. But I wrote something for the Critic this week saying that if the government, and Liz Truss kind of just leant slightly in this direction when it was rumored she might be getting rid of the sugar tax. If the government tomorrow said we're going to relax the smoking ban, we're going to get rid of plain packaging for tobacco, we're going to get rid of minimum pricing in Scotland and Wales, we're going to halve taxes on alcohol, we're going to get rid of the sugar tax. People will be up in arms going, well, we're going to be a pariah. The whole country's going to fall apart without this regulation. And yet that just describes what the situation already is in places like Germany and Luxembourg, who seem to do perfectly fine without any of these policies.
So I'm kind of interested in thinking quickly before I get into a little more depth about the UK, about what we're kind of comparing here. So is Germany, would you say in absolute terms, not particularly nanny statist, or is it just in relative terms that everyone's a bit nanny statist and Germany is just at one end of it? And secondly, why do you think that is the case? Because I think there's, and you pointed out in something Ryan this week, that we see the UK as freewheeling British liberty. We see Germans as quite strict and controlling. At least that's the kind of stereotype. Doesn't seem to carry through in your ratings of what you would almost expect from kind of the historical understanding of different political cultures?
Yeah, well, I mean, Germany obviously has had a history of quite authoritarian rule at times, and I think that's one of the reasons it doesn't have now. It's a direct backlash in some respects to the governments of the 1930s and 40s. I mean, it genuinely is. Whereas you've got other countries like Eastern Europe, which initially, after the breakup of the Soviet Union, went very much in a kind of free market direction, and some of them still have that to some extent, but over time, the kind of the regulatory state has kind of crept back in, and particularly on issues like alcohol. So yeah, it might seem surprising to people, but the idea of Britain as a liberty-loving nation of rugged individualists is a self-serving myth, really. And you get the same self-serving myth in Ireland, where it's even less true, and in places like California and New York and Australia. I mean, all the places that you think of as being traditionally kind of people who do what they want, they don't at all. They're the worst countries for capitulating to these people. And I imagine that the nanny states consider it quite a scalp to be, taken over the likes of New York and Dublin. So yeah, that self-image people have, or maybe the image projected by others, hasn't really stood up for a very long time. It's simply not true. At least people in Scandinavia kind of recognize that they have a big government, and they seem to kind of like it that way. Whereas in Britain, we pretend that we defend liberty, and we capitulate to all sorts of single issue pressure groups all the time.
Is the pressure for that quite elite driven though? I mean, I suspect there isn't that much public engagement on the question of whether or not you should ban junk food advertising. Maybe if you ask the public, there wouldn't be uproar, but I doubt they'd list it in their top 5 or 20 priorities. So what is driving the policymakers in that direction is always an interesting question.
Well, you make a very good point there, that if you compare these policies to any other major public policies, they're not salient at all with the general public. So surveys have shown this, that people are much more interested in all sorts of other policy areas rather than these. And yet these issues just keep coming up, and it's just one policy battle over after another, and usually the nanny statists win it. Why should that be? And it's a very interesting question, because paternalists don't really represent any particular constituency. There's no particular group of voters who really benefit from most of this stuff. Now, it's possible.
And also no one's going to the polls saying, well, I wasn't going to vote Tory, but because they want to ban junk food ads, I'm now going to vote Tory.
Yeah, right. There's very few people going to vote a particular way on these issues, and the people in public health who are but the only people who are genuinely passionate about them probably wouldn't vote for the Conservatives anyway. So you might think, well, after 13 years of Conservative government, why are we still getting all this stuff? I think it's more the public health interest groups, as it were, apart from the fact that a lot of them are directly state funded, they don't, as I say, paternalists don't really represent anybody else. There's not millions of people who feel very passionately that other people shouldn't be doing anything. I mean, you get people who are just prejudiced or feel even like they're altruistic in some way because they're clamping down on other people drinking or smoking, what have you. But they don't care that much. And because why would you? You haven't got that much skin in the game. You haven't really got any skin in the game. The only people who've really got skin in the game are the public health groups, who are themselves self-serving to some extent. If they're being funded by the government, they need to show that they win policy battles, and they've got to keep finding new policy battles to fight. Otherwise, the justification of their existence goes out the window. So what you end up with, and this is very much in line with public choice theory, is very small concentrated interest groups battling it out. And they're usually battling it out with very small concentrated interest groups from industry, because industry are, they've obviously got their own self-interest reasons for not wanting to be massively overregulated. But there are millions and millions of consumers who are affected by these things, but only in a relatively small way, too small a way to justify them spending a huge amount of time and effort fighting these things. So in practice, what you have is a very small group of public health paternalists who are fighting against a very small group of usually industry-based groups, and that's how the public see it. And naturally, the public will side with the nice doctors rather than with the the rich businessmen. But what is the group that's left out, obviously, is consumers. The people who don't consume the product have no particular reason to care either way. And they don't when compared to other policy issues. They might say they support it if you just give them a choice between would you like to ban junk food advertising or would you not, particularly if you call it junk food advertising rather than explaining what the actual food products that are going to be affected are. But their passion for the issue is likely to be very, very small. And is limited literally to ticking a box on a survey. They're not even probably going to sign a petition for it, let alone go out marching in the streets for it. But the same is broadly true of the people who do consume the product, because although they are more directly affected, they feel they can probably free ride on the opposition that the industry groups provide. But even if they couldn't do that, again, they don't have a sufficient incentive to get on a coach at 5 in the morning and go down to Trafalgar Square at the weekend and protest outside Parliament for what is probably a lost cause.
Yeah, I think it's an interesting dynamic here where you effectively have a very strong elite consensus in a certain interventionist direction, and there's philosophically level very low opposition to that. And then I think they'll also make other arguments around which you spend a lot of time debunking, but seems to persuade them that in fact these policies are necessary and effective. Like we can't underestimate the fact that they at the very least have managed to persuade themselves that calorie counts on menus might be effective at reducing the amount people consume and therefore helping save our precious NHS. And there's a kind of
right. So that's the only really sort of rationally self-interested reason people who don't consume a product could have for supporting paternalistic measures against other people, if they genuinely believe that they're going to pay less tax because the NHS is going to become more efficient. And no doubt a lot of people do believe that. It's not true for reasons I won't go into now, but I've gone into many times in the past. In actual fact, the healthcare savings or the welfare savings are likely to be very small indeed. And actually these policies, if they worked, would probably cost the general taxpayer more money. But
I just pausing there for a second. I think it's an interesting point here that, of course, when Beveridge kind of proposed the NHS and it was introduced, it was thought that spending on healthcare would go down because people would be healthier. And in fact, the opposite happened, which is once you start insuring people live longer, they end up having more conditions and more demands on the health system over time.
Yeah. So when the NHS was formed, it cost less than 1% of GDP, and now it costs 12% of GDP. So that little theory didn't seem to quite pan out. But that is, if people, people definitely do believe that, and people say it all the time that they think that smokers or the obese are a drain on the NHS, and therefore we need to tackle these things in order to save other people money. I don't believe that people actually feel that so strongly that it explains their support for these policies. But I guess even if they think there's only a very marginal gain to them, that's enough to support the policy, right? Unless you actually believe in the principles of individual liberty, or you're worried about the slippery slope and you think that actually if they start on these people, eventually they're going to get to me. If you take a bit more of a long-term view, as I do, then you get worried about all these things because it all builds up to a bigger picture of state intervention. It sets dangerous precedents. But if you're just thinking in the short term and you do believe that maybe, as the government said yesterday, ludicrously, their restrictions on where you can put certain food products in supermarkets is going to produce 57 billion pounds of savings. Just an insane estimate. I don't know what impact assessment came up with that. But if you believe that kind of stuff, even if you believe it's only 57 million, it saves you 10p. It's still better than saving nothing at all. Given that the policy won't damage you otherwise, why wouldn't you support it on paper?
Yeah. I guess also the kind of almost philosophical prioritization of freedom is something you can't necessarily monetize. So that kind of trade-off is not something most people who go into policy making are particularly interested in. Freedom is not something you can put in an impact assessment, but the monetary costs of obesity are, or at least your estimates thereof. I've kind of taken us on a bit of a tangent. We haven't gone too much into the UK results. So as you said earlier, I believe that the UK has gotten one place worse since last year. And the only saving grace is the approach to vaping. I'm interested in why the UK seems to have taken, a different approach, particularly compared to, my home country in Australia, where vaping is effectively banned unless you get a prescription from a doctor. Same kind of very strong anti-vaping policies in the US, although it is legal. Lots of anti-vaping policies across Europe. Why is the UK chosen a slightly different path here?
Basically, because the public health elite in Britain took a different view to the public health elite in Australia. These decisions, when it comes down to it, are made by a fairly small group of people. In both countries, those groups are fanatically anti-smoking. It's just the ones in Britain feel that the best way to bring down the smoking rate is by getting people to switch to vapes, rather than trying to ban both vapes and tobacco at some point. So it really is just a difference of opinion. And once both groups kind of took their stance a few years ago, they kind of dug in, and I hope obviously that the British public health lobby continues to maintain that stance and dig in, because it's obviously the right one. It happens to be the more liberty enhancing one, but it also happens to be one that's more beneficial to public health. So I think it really is just as simple as that. It's kind of an ideological difference almost, in that you've got people in Australia who are leading the conversation, who just have this kind of vision of a nicotine-free world, whereas in Britain, the public health academics have, ever since the 70s, had a kind of harm reduction view, which has been a little bit different to not just Australia, but many other countries. And so the foundations were already there for the acceptance of e-cigarettes in a way that they weren't in Australia, where you have to remember e-cigarettes were already de facto banned, because all nicotine products are banned in Australia unless they're in pharmaceuticals or in tobacco. So they started out from a position of, well, we've already got prohibition and we kind of need to justify it. Whereas in Britain, we started out from a tradition of, wouldn't it be nice if people could take nicotine without getting the health harms?
More broadly speaking, though, the news in the UK is not particularly positive. You just said, I don't know whether you've done the calculation, but if you strip out vaping, where does the UK come in the overall ranking?
Yeah, I was thinking about this the other day. I haven't actually done the calculation, but it must be around about 4th or 5th at least, because it comes top for tobacco, comes second for food and drinks, and it comes about 13th for alcohol. So I think it would probably end up in the top 5, roughly speaking.
And what direction are things kind of going in the UK at the moment on these policies? How has it changed, and what's next?
It's going to get worse. I mean, one of the reasons alcohol is only 13, UK is only 13 for alcohol, is it's tended to, the government has tended to freeze alcohol tax, actually, most of the last decade. Most years in the last decade is tended to freeze alcohol. Even, I think, George Osborne knocked a penny off a pint at one point a few years ago. And funnily enough, we're quite liberal on alcohol advertising. Quite a few countries are very, very harsh on alcohol advertising, particularly in Eastern Europe, but even France. Whereas, although Britain is quite uptight about alcohol in lots of ways and very heavily taxes it, we've never had particularly draconian rules on advertising. But that the taxation side of it is set to change in August, because there's going to be inflation index-linked tax hikes on every form of booze, I think. So that will be double-digit increases in taxes there. And we still have more of this anti-food stuff to come. So far, we've seen the calorie labeling on menus, and we've seen the ban on positioning cheese and bacon at the end of aisles in supermarkets, which is going to save us £57 billion. But there's more to come. There's the buy one, get one free offers, the volume price discounts. They're going to be banned in October, supposedly. That was already pushed back from last October because there's a cost of living crisis. And it obviously is not great optics for the government to be banning cheap food deals during a cost of living crisis. But of course, since then, food inflation's got even worse and is now about 19%. So it remains to be seen whether the government is going to have the brass neck to enforce this ban on food, cheap food deals, when inflation on food is in double digits, and they're going around groveling to the supermarkets, asking them to bring in a voluntary cap on food prices. So we'll see whether that comes in, but you would think there's a good chance that it won't do. And on top of that, you've also got the food advertising ban, watershed ban on television and around the clock on the internet. And just one point to make about this is that, when I said before, people are so parochial and they kind of assume that the regulations that are enforced in their country probably broadly similar around the rest of Europe or the rest of the world, and they're not. Well, this food stuff, you've got the public health people screaming blue murder, saying the government's dragging its heels on this, and even the stuff that's been tabled and legislated for is nowhere near sufficient. Well, actually, it goes beyond anything else pretty much seen in the rest of the world. Hungary is the worst country in the Nanny State Index because it has an extensive array of sin taxes on all sorts of different foods, which, to be fair, we don't. We just have the sugary drinks tax for the time being. But Hungary and no other country that I'm aware of has the kind of advertising restrictions the government's going to bring in, has this ban on buy one, get one free, has these restrictions on where supermarkets can place their products. As far as I know, this is all totally unprecedented globally. Okay, so we are going way beyond what any other country is talking about, all because apparently, Boris Johnson had a brush with death in April 2020.
Yeah, and he had his conversion from Jaws shark-loving libertarian to Nanny State
lockdown-loving anti-burger man.
Yeah. Very, very confusing man indeed. How do things compare across the UK? Because of course there are different policies for public health, and I believe it's devolved responsibility in Wales, England, Northern Ireland, and England.
Yeah, well, Scotland's even worse because the SNP's been on a bit of a temperance kick for the last decade or so. So they've got minimum pricing. Wales has got minimum pricing now for alcohol. There are also a few other little regulations that the SNP have brought in, really just to try and distinguish themselves from Westminster. They've got like a 3 for 2 offer ban, kind of a bog off ban on booze. They've had that for quite a while. They've got a lower drink driving rate. I mean, drink driving isn't really a part of the Nanny State Index, except for the countries that have like a 0 level. And this is another kind of grey area, I guess you could say, because I mean, even pretty extreme libertarians accept that there should be laws against drink driving. But when you set it at the level at 0, what you're basically saying is you can't have a drink the night before you go to work, or the night before you're driving the next day. So it effectively is a temperance measure, really, rather than a genuine road traffic policy. But yeah, Scotland's got a few extra policies. Minimum pricing is in place in Scotland and in Wales. Northern Ireland, I can't think of anything in particular that they have that we don't. They're still intending to bring in minimum pricing at some point, now that Southern Ireland's got minimum pricing. But given how much booze they're selling to people coming up from the south, I don't think they're in any great rush to do that.
And finally, I'm interested in your findings in terms of the effectiveness of this, because you would think now you've got kind of a decent sample of countries, you can kind of figure out, what is the impact of these policies on things like life expectancy or obesity or anything like that across different countries.
Yeah, well, ever since we've been doing this, I always correlate the Nanny State Index scores along with life expectancy, which is obviously the most obvious measure to kind of gauge the health of a nation. And there's never been a correlation. There isn't a correlation this time. Now, you might say that's a very broad measure. Obviously, there are lots of other things that affect life expectancy, although, of course, smoking and obesity is meant to be two of the biggest ones. But if you then narrow it down a little bit, just look at the tobacco scores, match them up alongside smoking rates, no correlation there either. Similarly, alcohol scores, no correlation with per capita alcohol consumption. So there isn't the kind of, even the vaguest hint of the kind of correlation you would expect if these policies were reasonably effective. And I think it's fair to draw the conclusion that most, if not all, of these policies are pretty ineffective. And given that they do have lots of negative consequences, I mean, sin taxes obviously make people poor, they increase inequalities, the consumer welfare point that you brought up before, often overlooked, but pretty important. If you believe in the well-being of society and happiness, and stopping people doing the things that make them happy is a pretty significant cost. And there are others, you get black market quite a bit, obviously with tobacco, huge black market pretty much all over Europe, but also alcohol, big black market, or at least a lot of cross-border selling and buying of alcohol, particularly in Eastern Europe. So there are all sorts of negative consequences from these policies, never properly evaluated in my view. And we just come to accept them because they're there and they've been there for a few years. And why would the government have introduced them if they didn't work? But I mean, if you look at the evidence on plain packaging, for example, it just didn't make any difference in this country. The minimum pricing evaluation in Scotland, with the exception of one modelling study, which looks pretty dubious to me, all the evidence coming out of that evaluation has shown it hasn't made any difference. If anything, heavier drinkers, particularly men, are actually drinking a bit more. You've got alcohol-related deaths at a 12-year high, and that's kind of like that across the board. These things fail for reasons that are fairly obvious, really, to the man in the pub, but apparently not to an intellectual library tower.
Well, Chris, and I think part of the excellent work you do is going back through the claims that were made when these policies were introduced, and then actually analyzing the studies and the claims about the data, which is always can be quite entertaining, if not quite depressing at times, as these things are done time and time again using the same four arguments. I think we might have to leave it there, though. It's been a fascinating conversation. If people want to learn more about Nanny State Index and your work, where can they go?
www.nannystateindex.org. That's a kind of vaguely interactive website. So you can look at all the criteria. You can download the actual publication. There'll be hard copies of that coming out, I think, in the coming weeks. And you can even, I think, download previous editions of it, but you don't really need to. And you can use it, don't forget, folks, as a kind of tourist guide. And there are some places now, and you really don't want to be going if you're a vapor or a smoker in particular. So you do check out what the laws are wherever you go, because about half the countries now on the list don't let you vape indoors, or anywhere you can't smoke, you can't vape either. And about at least half the countries are charging tax on e-cigarette fluid. The EU is planning apparently to have an EU-wide tax on vaping. So if you're looking for a Brexit benefit, us not going along with that would definitely be one. So yeah, it's out. Download it, nannystateindex.org.
Well, from the German Tourist Advisory Board, Chris Snowdon, of course, thank you very much. Chris is the head of lifestyle economics here at the IEA and the co-editor of the Nanny State Index. If you're enjoying the IEA podcast, please do subscribe on your chosen podcast provider, or also the IEA's YouTube channel. You can also learn more about the IEA's work by visiting iea.org.uk.
Well, if you enjoyed that conversation, why not watch one of these other videos? And while you're here, remember to hit the subscribe button and the notification bell. That way, you'll never miss out on a single IEA broadcast.